Patients come into behavioral health at their lowest point, and oftentimes they don't feel like they're worth living anymore. Giving them that attention to show them that they're worth, not just tell them what they're worth, but actually taking the time to let them see their own worth is important so that they can be successful as they discharge back into life.
Mental health has been a stigma for generations, and I think it's time that we break that because everybody's suffering from some sort of mental health, whether it's minor anxiety or extreme schizophrenia where you don't know what's going on. It's everyone's in between, or somebody knows somebody that has, that issue, and I think it's the foundation of part of our well-being. We always want to fix the physical, but you can't ignore the most powerful organ in our body, which is the brain. And I just think that's, what makes it extremely important.
I would say as early on as high school, I knew that I wanted to work in some type of mental health career. I had seen some really rough situations with peers, experiencing loss in our own class to suicide at the time. As a psychiatric assistant, I am there for patients during my whole shift. I help patients get things that they need, shower supplies, just general day activities. I can also help sit and talk with patients, playing a game with a patient while they chat about everyday life, kind of bringing some normalcy to life and helping their coping through just a normalcy in the wake of the most abnormal situation.
I never really knew what I wanted to do when I was growing up. I love the outdoors, and I've spent a lot of time in the outdoors, and that's the original career that I pursued. And I just realized that I wanted something that I could make a difference in people's lives and, make meaning. And I decided to get into, originally I was a surgical tech, but after that, working close with nurses, I decided to continue my education, became a nurse, and realized that's where I wanted to be. Decided to go back to school again and found myself in mental health.
We start with a psychiatric assistant. That can be someone who is just out of high school. The nurses that work on the floor. We have an intake nurse who takes calls from other hospitals and our own ED to try to place patients in behavioral health units. Our RN case managers who really set people up for success when they discharge from us. And then we have our medication aides that pass meds at subacute. We have a coordinator role that is a bachelor's degree level. I have a recreational therapist who has a recreational therapist degree, but also an activity specialist, clinical resource nurse that has a master's degree. We have nurse practitioners on the floor, and we have psychiatrists on the floor.
Having learned psychology for 4 years in a textbook, you see it come to life and you realize that the textbook is one dimension of a multi-dimensional person. Each diagnosis, each disease is so multifaceted compared to what you see in a book. And so you see it lived out in the most extreme and most minor versions. And then as you see patients progress and get ready for discharge, you can see them go back to baseline, almost like a scaling back. And so seeing that progress getting made almost physically is really rewarding. And then also being a part of talking to patients and understanding their stories, that helps that process feel fulfilling to me.
I don't think in any other department or any other nursing that I've worked in where you get to see someone go from extremely sick to like you would never know that they were sick. And that is like the most fulfilling part, is to be able to see someone that you can't even have a conversation with because they are in a state of psychosis, and then next week you're sitting there having a complex conversation about life and their aspirations and goals and what they want to be when they get discharged. So that's pretty amazing.
If you genuinely enjoy helping people, if you feel a passion towards just person-centered care in general, healthcare is one way that you can use your skills and grow as a person doing that. And there are so many different careers that you can go into that aren't just doctor or nurse or provider or something that you see as healthcare. There are so many other supporting roles and other roles in healthcare that you can strive doing, and just looking into it and seeing what fits best for you.